Hi, welcome to Mental Health Talk with Serenity Castle. My name is Chi, and today I'll be your host. And subsequently, for the next series, we'll be hosting for the next couple of weeks. I'd like to talk about a topic that I know a lot of us are wondering. Many of you who visit our pages know what we are about. We're about offering quality treatment and recovery services for all forms of mental health and addiction related problems. So, today I'd like to talk about a very common denominator that everyone who is experiencing diverse types of mental health conditions or addiction have in common. And no, it's not gender. Everyone who experiences mental health conditions or addictions are not all male. They are not all female. They are not all rich. Well, against the myth that a lot of people spread, they are also not all young, unlike popular opinion. But guess what? They all have families. And that is a common denominator we would like to explore for the next couple of weeks. Why family? Why is family such a big deal in affecting the prognosis that either someone recovers successfully or not? Why is family also very, very important and arguably the most effective methods of prevention from leading someone down the road of mental health illnesses and addiction? Why is family such a big deal? Well, I'll be exploring this topic with you today and in subsequent episodes. Stay tuned. We have established that everyone is part of a family. That's something we all do have. And that, interestingly, is one of the most effective points to ensure that we do not worsen our state mentally, we recover faster, and go on to live overall well lives. So, for a start, let's talk about why we call addiction a family disease. I don't know if you've heard this before. It's often a statement that meets a lot of families with shock, sometimes with insult. A lot of people feel insulted when you say addiction is a family disease. But I'd like to clear the air on why we say that. I'm an addiction counselor and I've been that for a number of years. One of the major things I assess when I talk to a client who is in addiction treatment or even mental health treatment is I ask about their support system. We call it recovery capital. And one of the major sources of one's recovery capital is their family. We ask about the family systems. How does the family work? What is the family role? What are the family responsibilities? What are the family rules, routines, and all whatnot? Even responsibilities are also highlighted. Why do I ask all these questions? Because this goes a long way to lay a stable foundation for that individual. Our family is the first institution that we are all exposed to. Our families is also the first point of contact where we learn a lot of things about the world. We learn how to talk, how to greet, how to respond, and how to interact with others from our family. So family is very, very important. It's almost like we're intertwined with our family structures, and no matter how hard we try sometimes, we really cannot let go of it. So why do we assess family very deeply as it affects someone's chance for recovery and overall well-being? And why do we call addiction a family disease? Reason number one, oftentimes addiction is more than just a problem, something that irk in our family that brings us a lot of shame, a lot of anguish. And as frustrating as it can be, addiction can actually show a lot about the family. I would even say addiction can be a mirror into the family system. In other words, addiction is more than just a problem. Addiction shows you what dysfunctions exist in the family, which you otherwise may not have been able to identify. And not just addiction, other mental health conditions too, like anxiety, or post-traumatic stress disorder, to a large extent, reveals what system is at work or at play in a family. So, family is very, very intertwined with these conditions, and it can also benefit. So from a loved one's addiction or mental health challenge, it can show a lot of light on what works or what is not working in that family. Second reason why we call addiction or even other mental health conditions a family disease. Two, families do not escape. Unfortunately, your friends could turn aside, your employers could turn their back, even the institutions that referred you could stop reaching out, but somehow your families are tied with you in this, and they get to go through the journey of healing with that individual. So that also is very, very important in either strengthening the family ties or weakening it. So if someone in the family has an addiction or a mental health problem, it will mean more than just a problem. It can also be beneficial in bringing members of the family close because they cannot escape it. They cannot cut themselves off of it. Number three, families are often responsible for the financial responsibility of one's treatment, either from a mental health condition or an addiction. They get to fund the bills, and even if they don't pay for the treatment, they get to subsidize the individual's financial spending for the meantime while they are going through that recovery or treatment process. So families are not cut out from it. But number fourth reason why I would say addiction or even mental health conditions is a family disease is that addiction or a case of a mental health challenge in one member of the family or even more shows you the issues in the family that other members of the family are finding other ways to deal with. What do I mean? Perhaps a second child comes down with a cannabis addiction. There is usually something linked to the cause or the driving factor of that person's addiction that other members of the family are also experiencing, but they are having other ways to cope. So most times, addiction or mental health challenges is usually a time for every member of the family to come together and have a conversation. What does this actually show us about what is working or what is not working in the family? What does this addiction or mental health challenge show us about an existing pain that we all have probably been too busy to resolve? And I would cite a very quick example that comes to mind. There was a client that I saw many years ago who was dealing with a stimulant use disorder. She was young, but it turns out that they had lost their mother a few years before then. And because she was closest to their mother, the grief was so much for her. Unfortunately, she found a solace in drugs, which wasn't really a solution, but became a problem eventually. But during the course of therapy, we found out that there was a need to ask every member of the family how they had resolved their grief from their mother's passing. Surprisingly, many members of the family had not resolved that grief. They had just pushed it to the corner, right? And focused on this person who had a visible challenge. Now look at that. So it becomes a landmine, a problem that happens here, waiting to happen again and again and again and again. So oftentimes, even though we know that having someone in the family with an addiction or mental health challenge can be very frustrating, and I say this with all the empathy in my heart because I know I've seen firsthand the pain, the anguish, the tireless heartache it brings to members of family to see someone they love so much struggling. But I would say it is not only just a problem. The essence of this series is to show you how important families are when it has to do with mental health and addiction. Today, we want to start off with considering the fact that sometimes the mental health or the addiction of a member of the family may not just be a problem alone. It could be an eye-opener, it could be an icebreaker, it could be the right nudge to put every member of the family to recognize how important that single, simple system of life is, not just for the individuals in the family, but for the larger society. And the next few episodes, I will be talking deep on how important family is and how so. So, in case you are watching this video and you have someone in your family who has a mental health challenge or an addiction, I know that it hurts. I cannot even tell you that I understand the full weight of it. But stop for a moment and ask, what could this be showing us about our family that we all might have been ignoring? You might be surprised what you find out. Thanks for joining our episode today on Mental Health Talk with Serenity Castle. And just in case you're looking for where to get the right support, we know this journey of supporting a loved one with a mental health or substance use condition can be tiring. Oftentimes families ask, what can I do? What am I not doing right? What am I doing wrong? Can I talk to someone else who's experiencing this? Is this normal? Is this not normal? In case you have all of those questions, you can join our free Smart Recovery Family and Friends meeting, which is a confidential mutual support program where you can talk, You can join anonymously via Zoom and talk to other people who have loved ones in addiction recovery as well, all around the world, and get some support and learn the right skills to help you cope and support your loved ones adequately. Once again, thank you. And until next time, take care.